Girls, for asking me to help you with understanding forest plot. Uh, I will add another clip here in this video that I made for part 3 students. That's something that I've already done, but I'll today add another clip at the end because there was some extra explanation that was not required for part 3 students, so I'll combine that one. Okay, I'm trying to do this amongst all the other activities of Ramadan. That's why I decided to combine the clips rather than making it from this scratch. But if there is something unclear, please give me a shout in the Telegram group. I'm very happy to help you further if I can. Okay, there are the links of the Telegram group in the description where people do request me topics to cover that they are not able to understand properly. So let me see if I can record this for you, this forest plot. Okay, so if you remember this forest plot, this one. Okay, so this is like this part of the forest plot. If you can see on the left upper side, this is a zone called descriptive zone of the forest plot, while this part is the graphic zone of the forest plot. Okay, and then this part is basically the statistical zone of the forest plot, where this is overall effect size and this thing is mentioned. Now forest plot could be homogeneous when all of the results are on one side, or it could be heterogeneous when the results are going on either side of this line. This line is line of no effect. Okay, basically like a neutral line, and it falls on one always. On one side of this the values are decreasing and into decimals, and on the other side they are increasing. Okay, the more something is close to the line of no effect, the less effective is that intervention. Okay, more is like a neutral one. So in some cases you will find two interventions, like here it says metformin and it says clomiphene. In some it says one intervention and then the other side is control only. Okay, these boxes um, uh, in front of these studies. So these are the studies. This number 1 is the criteria. So they are saying that these criteria, include the studies where the BM or the studies where the BMI of the patient was less than 30, okay, or less than 32 in some cases. They found 3 studies in there, so 1, 2, 3, and there were these 3 studies. There's these boxes represent the weight of the studies. Okay, um, now the bigger the box means more the weight. Okay, here they write weight in decimals, in percentages as well. So if you see that this is a big box and this is almost equal to this, so this is 37.9 and this is 35.8, so it has almost same weight. This is slightly smaller, and in percentage you can see that this represents 26.3% of the weight, and it says 100% because it's subtotal of this upper part. Okay, the participants with a BMI of less than 30. Similarly, in the other studies where they found that the participants were more than 30 BMI, they found 2 studies. So these are the results of those studies, and this is the weight of this one study is so big, like almost 90%, and the other one is only about 10%. And this one is you see the diamond in the upper one is falling on the right side and diamond in the lower one is falling on the left side, because the most of the studies on the upper one are falling on the right side. The third one is falling on the neutral line, but you see that less part of the this box is on the left of the neutral line and more is on the right. So mostly this diamond is on the right side. Here most all these 2 are on the left side, so the diamond is on the left side. Okay, so diamond is the subtotal result of these ones. Okay, so basically what's happening here, this is a result of a meta-analysis. Meta-analysis, what is meta-analysis? Meta-analysis is basically like systematic review is a review of various studies around the same topic. When you summarize the result of various studies around the same topic, that makes it systematic review. When you pick up the statistics from that and you do an analysis of that in this and represent it, do the analysis of that, it becomes a meta-analysis, and then you can um, present that such statistical analysis or the meta-analysis in the form of a forest plot like this. So I hope this is clear. It should not be a problem really. You will just need to remember that more something is close to line 1 to this line of no effect, more it will be, you know, um, less it will be considered to have effect. Further away means more effect. Okay, so the odds increase when it goes away from the, when any figures or any box goes away from these this line of no effect, then the odds will increase of something. Okay, odds of something being effective or something being tested increases. Odd ratio or odd, it increases. Okay, closest to 1 will be, odds will be very less. Okay, so I hope this is clear. And if it comes as a teaching, this is it. You can explain this much and that should work really. I don't think you need more than this. So we just discussed that forest plot, it displays effect estimates and confidence intervals for both the individual studies and the meta-analysis. So these are the confidence intervals, the length of this line, a horizontal line that indicates confidence interval. These, as we said, were the size, and size would depend upon the number of the patients that were recruited in studies. So these boxes, the size of the boxes indicates the size of the studies, or the weight of the studies. Okay, so we also said that the closer these boxes are to the neutral line, the lesser effective the intervention would be. Okay, the farther away they are, the more will be the odds of the intervention being effective. Okay, on either side of the line, farther they are from the line, there are higher odds that this intervention will be effective. So as we said that sometimes there is uh, an intervention on one side and there is control group on the other side, but here we can see that there are interventions on both the sides. Okay, so here metformin is mentioned and here it says clomiphene okay, so here when we see if we see that some studies are falling on right on the neutral line or the line of no effect, which is on number 1, then that would mean that these studies actually didn't have any effect. This intervention didn't have any effect compared to if there was no intervention. Okay, so if there are two if 1 out of 3 is falling on this one, so you can, on this line of no effect or neutral line, then you can see that there isn't really a lot of you know um, uh, that there is no effect that was found in this particular study, but this was slightly away from the from this line. So these two studies did find some effect. And whose effect is finding? If you have this chart in your exam, if this plot in your exam, you quickly need to see what is the where is the these boxes are falling on which side of the chart. So if it was, say, written an intervention here, like metformin is written here, then it means that these favor um, these are saying that the intervention was favorable, like it has a favorable outcome. Okay, so metformin was found more effective. We'll just talk now in what case is more effective, but let me go on to this one. So these boxes are indicating that in these studies clomiphene was found to be more effective. Okay, So there are only two boxes here. This diamond is like a sum of this, or average effect, or sum of this effects, okay? And this diamond here is the sum of the effects of these studies here. So remember, whenever you see this plot in the exam, quickly have a look at what are the arms, okay? Then see what are the what studies are falling on that side. So if these studies are falling, then quickly see what were the uh, these details of these participants. So for instance, from this one, what I read from this quickly is that I see these boxes are on this side, that it says metformin. I'll quickly see that metformin was found to be more effective intervention in cases of participants who had a BMI of less than 30, okay, or in some cases less than 32. Okay, so I'm quickly thinking like this: these boxes are on this side, this represents metformin, and this means that this intervention was found to be effective in the participants who had a BMI of less than 30 or less than 32. On the other hand, I see that okay, these boxes are here. I'll quickly see, because we don't have time, isn't it, in the exam. So we'll quickly see that okay, this says clomiphene, so clomiphene was found to be effective in which group. So these are the participants with BMI more than 30. Okay, sorry guys, I'm fasting and my throat gets dry really quickly. I do apologize for that. So yes, here we see that I'm quickly having a look, and I'm seeing that these boxes are on this side. Which side do they represent? This is not the control arm here. This is the clomiphene arm here. So, okay, I'll see quickly what group do they represent. So I'll quickly see what were the features. So there will be a question underneath this forest plot in your part 2 exam that will say that this study indicates, and there will be, like an SBA, and it will say, will have various things mentioned. Okay, you have to make sure that whatever out of those one statement will be correctly reflecting the picture here. Okay, so for instance, it may say that metformin was found to be more effective in BMI less than 30, so that should be correct statement. Okay, or it will say that um, clomiphene was found to be more effective in cases of BMI more than 30. So if this is the case, then yes, you will say yes. Okay, so that will be correct statement. If it says anything other than that, then of course you will say that that's not correct. Okay, so I hope this becomes really easy for you. Please watch this few times and you will be able to absorb it in a good way. Okay, and I hope this is not, there's no further complication in this, but please get in touch if there is. Okay. Um, One thing that I would want to say is that uh, if if everything if everything falls on the neutral line, then again you will have to conclude that none of the intervention was effective, okay, in either of the groups. So okay, good luck with your exam preparation, and bye bye.